Dr. Gelrud, could you describe for me what is a good nutrition plan in chronic pancreatitis?
Dr. Phillips, that's another excellent question. Nutrition plays a major role in chronic pancreatitis. Actually, I would say that it plays a major role in any chronic condition. Of course, when we're talking about chronic pancreatitis, that it's the main organ in charge of enzyme production, so we can our body can function in a normal way thanks to nutrition. It plays even a more important role. Most of us that are taking care of these patients with chronic diseases of the pancreas will have a nutritionist in our clinic or a dietitian, somebody that can help our patients know exactly, or at least give them a very good idea of what type of foods they can eat or not. And this is very important because frequently patients will get in the internet and they'll start to read these different diets, and they'll get, in what I have seen, at least in my personal clinic, in personal experience, is that some patients, being very obsessed in eating right, they get into these crazy diets and they don't realize that they're not eating a lot of things that they could have been eating. So the diet may be more broad than what they're doing. So having a dietitian, having a nutrition, having an expert with us, work with the patient, it's pivotal, it's extremely important. Again, if you have chronic pancreatitis, we always advise the patients, to stop drinking. We always advise the patient to stop smoking. We make sure that they understand that hydration plays a major role in this condition. The pancreas likes to be surrounded by water. So we always tell them, how important this is. And in general, we tell patients to be in a low-fat diet, particularly if they have pain. It's a little bit controversial for patients that don't have pain because they can have a little bit of more of a broad diet with more fat in their intake, as they don't have pain. So stimulation of the pancreas won't worsen the intensity of the pain. So these are the type of things that we do. I also want to mention that the National Pancreas Foundation just published or recently published a cookbook for patients with diseases of the pancreas. And you can download this book into your computer so you can get a lot of ideas of what things you can eat and what you should avoid, but mainly giving you a lot of ideas of different recipes that you can do at home. So long answer short, be careful with what you eat. Make sure that your nutrition eats well. Make sure to ask for help. If you're a patient, tell your doctor that you would like to see a nutritionist, somebody to help you understand what type of things to eat, what not to eat. Hydration is very important. Please stop smoking. Please stop drinking if you're doing those. Get your underlying conditions under control. Take advantage of the National Pancreas Foundation website. There's a lot of information. There's a cookbook, if you haven't seen it, that you can download it, and it will give you a lot of good ideas of what to eat and what not to.
And, I was just going to add one point, which is a peculiar point to chronic pancreatitis folks, and that is that the second problem that some patients can get is diabetes. And so there are also a variety of dietary recommendations and nutritional recommendations that relate to diabetes. And it can be complicated sometimes to sort through the usual recommendations for a diet with diabetes and the recommendations of diet with chronic pancreatitis. So having a person that's experienced in that, a nutritionist or a dietitian that can help you plan your particular dietary strategy is very useful.